If you just think about one of these families employed in one of these small businesses, without health insurance, the job becomes unaffordable. And the family is actually at risk, the entire family, of medical debt. If that person who is uninsured because they work at a small business has a heart attack, suddenly their family is in $100,000 of debt. And that changes their entire universe, right? Now they can't afford to buy the new house. Now they can't afford to send the kids to college, right? So we're talking about kind of existential issues for families.
Hey everyone, this is Jonathan Marks from Go to Health. Welcome back to another show. Policy experts say a bill under consideration in Congress could impose the largest cut to healthcare programs, including Medicaid, in U.S. history, with significant consequences for small business. A new report from Georgetown University Center for Children and Families and the Small Business Majority outlines Medicaid's role in industries like childcare, construction, restaurants, transportation, real estate, and home health services. Our guest today can break down the study's findings, explain how the proposed cuts would affect healthcare coverage for working families, and discuss the long-term implications for small business owners and their employees. Even if you're not on Medicaid, these cuts are so drastic that all of us will be affected because of the effects on small business. So welcome to the show, Leo Coelho. How are you today?
Thanks, Jonathan. So great to be with you.
So, what does the new study from the Georgetown University Center for Children and Families and the Small Business Majority reveal about the relationship between Medicaid and small businesses?
Right. So the new report shows that Medicaid coverage is critical to small businesses and their employees and their families. Small businesses face higher healthcare costs in the private insurance market, and they operate on smaller budgets. So it's just really hard for them to offer coverage for their workers and families, which is why Medicaid plays such an important role. And the study shows that if we look at Medicaid enrollees, one-third of Medicaid enrollees are connected to small businesses,
Wow.
either owners, employees, or their families. So as Congress is considering the largest Medicaid cuts in history, that would have an incredibly harmful impact on small businesses, employees, and their families.
Got it. And which industries or types of workers would be hit hardest by the proposed cuts?
So the proposed Medicaid cuts working their way through Congress would leave millions of people uninsured, including many employed in small business sectors. If you think about your community and all the businesses that sustain it, we're talking about childcare centers, all of the shops and restaurants, your local diner,
Mm.
your local hardware store. In construction, think about the contractors, the subcontractors. And, on topic of healthcare, home health, the people taking care of seniors, the people taking care of kids with disabilities. All of these are predominantly small business type sectors that would be really hurt by these Medicaid cuts.
And we usually think of big corporations as driving the economy, but we know that small businesses are really the heartbeat of this economy. There are so many small businesses that provide so many services. So the cuts to this will really have huge effects across the whole economy, which will affect not only those people who are getting cut, but will also affect us who may not be affected directly at all.
Yeah, these cuts really affect the whole community in a lot of ways. One is job growth. These small businesses fuel job growth in communities. Small business owners who can't find employees or go broke trying to pay for healthcare benefits are going to have to close their doors. We're talking about entrepreneurs that are pursuing the American dream who have to give up on those dreams. But these healthcare dollars also play a really important role in the economies of communities. These Medicaid dollars that come in themselves lead to more business and more growth.
We've done a number of interviews with you folks, and you're doing amazing research. Can you tell us more about your organization and what it is you do?
Sure. So we're a center within the School for Public Policy, the McCourt School for Public Policy, and we have a team of Medicaid experts that looks at all of the data, looks at the proposals coming out from the different government agencies, and we try and make recommendations and put out analysis to help people understand how healthcare programs, particularly the Medicaid program and the Children's Health Insurance Program, can better serve children and families, just promoting policies that will get families the opportunity to do the other things they want to do in life instead of having to worry about the health care of their kids and figuring out all the things parents currently struggle to figure out.
Right. So let's go into a little bit more detail. How will this one big quote unquote beautiful bill impact healthcare costs for entrepreneurs and working families?
Yeah, so, as we said, many workers without Medicaid would be forced to leave their small business jobs that don't offer health benefits. Their employers aren't able to afford it, right? And so where is the opportunity for employment for these people? They just are not going to have one, or they're going to have to move away from all of these small businesses. And so the ability for these families to have that security goes away. If you just think about one of these families employed in one of these small businesses without health insurance, the job becomes unaffordable. And the family is actually at risk, the entire family, of medical debt. If that person who is uninsured because they work at a small business has a heart attack, suddenly their family is in $100,000 of debt. And that changes their entire universe, right? Now they can't afford to buy the new house. Now they can't afford to send the kids to college, right? So we're talking about kind of existential issues for families.
Got it. And let's talk a little bit about how Medicaid works. Now, Medicaid is funded by the federal government. Do the states pay a portion of Medicaid? How does that work?
So Medicaid is jointly funded between the states and the federal government. So it's truly a partnership. And what happens when you have these kinds of healthcare cut proposals where the federal government is cutting its part of the deal, it's not saving money. It's just shifting the costs onto the state. I liken it to you go out to dinner with somebody, and when the check arrives, they run out of the restaurant. They didn't save money. They just stuck you with the check. That's what these legislators are doing to states and counties and local districts when they chop the federal funding in this jointly funded program.
Now, if this gets cut at the federal level and is now the states have to rely on funding all this, what are the states' choices? Do they have the money to fund all this?
So these cuts are so gargantuan that no state has the ability to backfill all of these lost federal dollars. It's just impossible. If they were actually making small, precise cuts to fix the program, we could be talking about what states could do. But
Mhm.
we're talking about $800 billion of cuts. So states cannot make that money up. So states are going to have to turn around and have really difficult choices. They're going to have to make huge cuts to healthcare. And so people are going to lose services. And the services that will be most at risk are some of the optional services that they provide to seniors, to people with disabilities, to take care of them safely in their homes. Really important services that are going to be on the chopping block. But in addition to that, you should understand that the federal dollars that come into states for healthcare allow the states to spend state dollars on education. That's where the states spend the most of their state money. You take away the federal healthcare dollars, and now the states won't be able to put as much into education. So this is huge consequences for state budgets and states well beyond healthcare.
And we've done a number of shows on the impacts to rural health. Can you talk a little bit about what the impacts to this would be for people who live in rural areas and the healthcare that they might be able to access?
Yeah, so it's devastating for rural areas. We actually issued a report a couple of months ago talking about Medicaid coverage in rural areas. And the upshot of it is in rural areas, you have higher levels of Medicaid enrollment because people are lower income out in rural areas. So if you cut the Medicaid program, you are going to hurt people in rural areas more than anywhere else. So it's very damaging to rural areas. In addition to that, the other really important point to make is one of the things this bill does is it's not just people losing health insurance, it's a defunding of healthcare systems, and in particular, the financing mechanisms that states use to reimburse providers, including rural hospitals, rural community providers. And those are precisely the providers that right now are having trouble breaking even. We actually have a problem in this country of rural hospitals going bankrupt and closing. And that's at current funding levels. So if you take the current funding levels and you drop them way down, we're going to see a lot more rural hospitals close. And I always remind people, if you're in a rural area even if you're not on Medicaid, you can't go to the doctor, you can't go to the hospital if though there's no hospital open.
Right. So, yeah, in rural areas, you might have to travel hundreds of miles to get to a hospital. So,
That's right.
what should lawmakers consider before voting on these proposals?
Well, lawmakers represent states and districts, and they should be acting in the interest of their states and their districts and their voters. And the Medicaid cuts that are being considered are going to lead to massive losses of funding for their states and for their districts. They are going to lead to huge increases in the number of uninsured people in their states and in their districts. And as we just said, they're going to result in hospitals and nursing homes closing disproportionately in rural areas, perhaps, but everywhere it's going to be a problem, which will be incredibly harmful to their states and their districts. So lawmakers should be rejecting any cuts to Medicaid because they're just bad for their state or district. So I think my takeaway message would be lawmakers should be looking out for the interest of their states and their districts and not playing politics.
Thank you. So, people want to learn more, you can go to ccf.georgetown.edu. And we do encourage you to get in touch with your lawmakers at the state and federal level to let them know what you think about these Medicaid cuts and how much it will harm your community. Leo Coelho, I want to thank you for being with us today. It's been really great to have you and learn more about the implications of these Medicaid cuts.
Thanks so much for having me, Jonathan.
So we've been talking with Leo Coelho, JD. He's a research professor at Georgetown University McCourt School of Public Policy and their Center for Children and Families. He's worked on Medicaid law and policy for the past 2 decades, most recently as the health policy director of the National Health Law Program. Again, thanks for being with us, Leo, and sharing this information.
Thank you.
This has been Jonathan Marks with Go to Health. Remember, we're on YouTube, we're on 8 podcast networks, and also you can subscribe to us at gotohealthmedia.com. Remember, as we say at the end of every show, go to health. We'll see you again next time. Take care. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.